welcome to a new episode of Hand That Rocks the Cradle. And every week we have a new mom and a new topic that we talk about. And just like always, today we have another amazing mom with us. We have Dr. Harsha Malhotra. She is a new mom. She has an adorable 3-month-old baby girl, and she's going to share with us about a topic that a lot of mothers have a lot of questions about, which is C-section recovery. So C-section is a major surgery, and recovery after that definitely varies from woman to woman, but it's great to know what other moms have gone through. So welcome today, Dr. Harsha.
Yeah, thank you. Hello.
These are going to be
Right.
rapid fire. Okay, so you can answer the
Okay.
questions in as short or as long as you want. And if
Yeah.
you're ready, we can just get started.
Yes, yes.
Okay, awesome. So first question to you is, how long after C-section does it take for you to feel yourself again?
It will take at least 3 months. At least 3 months. It is a myth that it will take 6 weeks or so, and you can start, like gymming and walking and all of that. No, of course, it varies from, woman to woman. But what I have felt from my personal experience, it can take more than 6 weeks of time. Yeah, right. 6 weeks, the outer part is healed, but from inner, you have still, I have some sensation in my uterus area. So it can take more than 6 weeks or so. Yeah, on 6 weeks, you can have a outer healing done. That's the point.
Got it. Okay, how was your emotional state you during the recovery in the initial months? How are you emotionally doing?
Right, right. So it's a roller coaster ride again. Okay. So in the first month, you are going, especially if you are breastfeeding mom. So you don't get time for yourself because you're continuously on cluster feed and first time mom. And then you feel sometimes frustrated as because, nobody else is understanding that problem that your child is cluster feeding, you have long nights and all of that. And they are like, the child will be gonna like that. So, the old wife tales like that, you are not getting enough supply and all of that. So, I have researched on that topic that it is not like that. Okay. The children, they go for cluster feeding and it is big. The supply will be going to be normal after some time. It is not like that. So, the first month, it was hard. But as I researched and I do the conversation, interaction with other moms also. So, it gets better and better by the time.
Okay, very useful information. Okay, your third question is that it's normally said that after C-section, breastfeeding is really hard because of the stitches. So, did you experience anything like that?
Okay. So for the first 2 days, yes, in the hospital, I have to take the support of formula milk, plus the breastfeeding. But in that 2 days, if you avoid breastfeeding, then your supply will be disconnected.
Got it.
So whether in the sideline position, if not, then take the baby on your chest, but do the breastfeeding. So initial 2 to 7 days, due to the stitches, you are not able to, sit and feed. But after 7 days, you can easily go into the sideline position and breastfeed your child whenever you want. So if even if the belt also, I can sit and breastfeed my baby.
Hmm.
In third day I got discharged only. So I was breastfeeding her continuously.
Wow, really nice. I good to like break that myth also. Okay,
Yeah.
so the fourth question is, how often do you need to see your gynec if you had a C-section, for postpartum, how often do you need to see?
No, no. If nothing is there, if everything is healed, I think 1 or 2 time I have seen her. That's it.
That's it. Okay. Any red flags that women should watch out for while, they are recovering from C-section, like stitches, pain, itching, like women complain a lot about itching on the start.
One thing I have noticed in my here, this, as we have, gone into immunity level low on the immunity level because of the hormonal fluctuations and all of the medicines we are going that.
Yeah,
So we are opportunistic to various form of infections.
right.
So I will, rather take the precautions before, like, you are opportunistic to fungal infection in your private areas. And I got so. So that's why if even I will be the precautious in the next pregnancy, it is better because our immunity line is low in that part. And various mom will get it or may have got it, but they are not going to share it. So I'm sharing on that part because we are opportunistic to that kind of infections. So rather take before the precautions before having that infections.
Yes, very important. Actually, really useful to
Yeah.
share that. Very important. Okay. What kind of support system did you have while you were recovering? Who was looking after the baby? How were you managing?
It's very difficult, you know. Yeah, the husband is really a supportive system in the nights and in everything, the moral support, the emotional support. But the men, they have to do work, they have to go out for the work. So eventually it's you and the baby. Yes, you get a lot of support from your mother, morally, emotionally, physically,
Correct.
and in my case, my sister. So she was there in the hospital, she was there at my home every time she was there, and of course mother-in-law is also there. But ultimately it's you and the baby.
Yes,
uh, Everybody can morally and emotionally support you, but at a part of time it's you physically present, you have to present for your baby.
correct. Yeah, true. And very you're really blessed that you have this kind of a support system around you. That's really,
Yeah, I can touch goal, I have that support system in my life.
yeah. Okay. Normally, like they say in C-section, that the scar healing internally takes time. So, have you experienced anything like that, or when do you think the
Yeah, it
scar
takes time.
completely
It's
heals?
definitely takes time because I am still, I just told you, I am still sensitive in my navel areas, and it's becoming less, the area is becoming less sensitive day by day, like something is constricting down. So outer part it is very much healed, very much so healed. But yes, inner part, it will take, I think, 6 months or so it will take,
It
what I am feeling right now.
Correct. Okay. Any tips that you use for recovery, like any exercises, any ointments that you are applying, any self-care practice that you do which helps you in recovery?
No, no, I just done the physiotherapy exercises which they have told me in the hospital, so
Okay.
that the moment of the back is not neglected. So I have done 3 or 5 sets of that exercises. That's it. Nothing much I have done for the healing. It will be going to heal itself. The body
Okay.
has that power that it will be going to heal.
Okay. Yeah. Um, how do you find time for yourself? Like, are you finding time to do something you like?
Yeah, I do make reels, I do photographs myself, so I'll get the time. You have to chase for the time, you have to thief your own time from your baby because the baby requires 24-hour attention. You can't schedule or plan anything, you have to be uh, flexible around your baby's schedule, but eventually you will get time. It's
Yes.
not like that you will not get time for anything. Even if not, do the reels with the baby only,
Yes.
by not by yourself. So it's like that.
Yes. Okay. Usually, like they say that there is a lot of difference between a vaginal delivery recovery and a C-section delivery recovery. So, you have any kind of opinions on this?
See, we get stitches. What I think is the uterus, the placenta is placed in the uterus that have the same scar formation that
Correct.
we have in C-section and that we have in vaginal delivery. Now we get a cut on the vaginal delivery also and in the C-section also. Right?
Correct.
So we are getting stitches in both of the cases. So
Correct.
it's not, if you are having a vaginal delivery normally without any, back and forth doing something, or if you are regularly having your vaginal delivery, it's okay. Otherwise, go for C-section. I cannot tolerate the labor pain more than 2-3 hours. So it's better to get by C-section. So next I'm going to plan my C-section. This was the first time, so I have induced my labor and all of that. But I have decided that I cannot take labor pain more than 2-3 hours. So it's better to get it done, If we have the technology, why should not we go for it? Because the cut is there in the vagina also you are having, and in the C-section you are also having. And plus what they say, in vaginal delivery, you will have less complications afterwards in your after your menopause. But what I have seen, true, because my mom or my ladies around me, they have vaginal delivery, but they are having slip disc, they are having uterine prolapse,
Oh,
they are having the osteoporosis, and the C-section ladies are roaming around very well apart from the scar. So it's not like that. I think it's depend upon your diet and nutrition and exercise and how you are dealing with it. Then both the deliveries are fine, I think so.
yes. Yeah, yeah. Very, very, very honest, very raw. That was really nice. Okay.
Yeah.
What was your biggest challenge while recovering? What do you think is the biggest challenge while recovering?
Mm, I think the breastfeeding
Yeah,
with recovery.
yeah. Okay.
Breastfeeding it itself is a challenge,
Correct.
you know, and you are getting so much of thoughts on that breastfeeding, the supply and all of that, and the peer pressure. You're not getting this, you're not getting that.
Right.
So I think that is the most difficult part, the breastfeeding along with the recovery. Recovery will eventually will be there, your body
Mm-hmm.
will be going to heal. But the mental pressure, if you have the breastfeeding, especially exclusively, then
Yeah.
it's really difficult.
Yes.
You doubt on yourself and all of that for the
Correct.
supply and all of that. But it's okay. You have to be rigid, you have to be strong, you have to be, conscious about your decisions and all of that. And you
Right.
have to be well prepared and researched about the facts.
Right.
And no, don't listen to anybody, not even to your mother. Just listen to your doctor. That's it.
Yeah, absolutely. And that's really important, because a lot of unsolicited advice you get from everybody around you once you have a baby.
Everyone, everyone.
Yeah. Okay, so last question now for you, Dr. Harsha, is that what advice will you give to moms who are, maybe going to have a C-section, or, who have just had a C-section? Any tips, any advice that, you think will help them, like in this process of recovery?
Just what I have faced is that only the infection part. Okay. Otherwise, I was prepared for everything, all the clothes and everything, and the hospital, gynec, post recovery, everything. Which I was not prepared about is this infection and the how tough is the breastfeeding.
Correct.
So, just on that part, you have to be ready and mentally prepared. And also, you will have to have some precautions that what can be done after the surgery if you have any infections or something like that. Otherwise, it's okay. And do have one like nanny for your hospital, for your house. Nobody is going to manage the baby with you apart after a limit of time.
Correct.
So you need to have somebody if you are a working woman like I am. So I have to visit my clinics, so I have to visit the I am the consultant orthodontist, so I have to visit my clinics once in a month.
Right.
And I have to start as soon as she gets, after 40 days, because
Right.
the patients can't wait. So I have to look somebody to hold my child so that I can go for my career.
Correct.
So that I think if you are a, physically you are going to office or something, so prepare one person beforehand rather searching after.
Correct.
So that was the mistake I have done. I have thought so. And if you're working from home and all of that, so that's okay.
Right.
It can be manageable.
Right. Yes. Thank you so much for coming today and sharing with such a small baby with you. It's very difficult to find time, but you still came. You shared so much of your experience with all our moms. And thank you so much. We know that moms watching this are going to benefit so much from this. So thanks so much,
Sure,
Dr.
sure.
Kishan.
Yeah, I'm thankful to you, Mayura. Thank you so much.
Thanks.